DDI is an organization dedicated to providing services to children and adults with developmental disabilities and autism that runs from early infancy to people that are approaching their 70s.
And DDI exists to provide the kinds of care that sometimes families find they're incapable of providing, either because of the demands that the care requires physically, or because of the special expertise that is needed to care for somebody with a developmental disability.
Every life is sacred. Every life is worthwhile. And no one knows what the potential of a human being is. We have a motto at DDI that says, "Hope has no barriers." That's what guides our activities each and every day.
Matt was a gorgeous little baby. He was wonderful. He was terrific. He was bright. He interacted with his sister. He was in every way an appropriate one-year-old.
He was very social. He had about a 30-word vocabulary. He was just a normal kid.
I remember the last time he was normal. I was walking him in his stroller, and there was a dog across the street. And he reached out and pointed, and he said, "Doggy." And that was the last time he did that.
Somewhere around 15 months, we started noticing that he really wasn't responding to us. So we thought that he had lost his hearing maybe. So we had his hearing tested. It was fine. And between that time and 18 months, he lost everything. He lost his ability to talk, he lost his receptive language, he lost his fine motor skills.
In essence, he lost contact with this world. He didn't hear what was going on, he didn't process what he heard, he couldn't express himself. He went into his own world. And, you know, the words that they use to describe it are useful, but at the end of the day, it is his own private world.
So we thought, well, we can't give him what he needs. He needs 24 hours of care.
We brought Matthew to DDI at around 7 years old. He's now 27. When we brought him, he was not happy. He was had problems with violence. He had problems with caring for himself. He's now 27. He has no problems of that sort. He has a fulfilling life. He works in several jobs. He lives in a home with his peers. He's well cared for and well loved. And the difference between Matthew at 27 and Matthew at 7 is the difference between night and day.
Within our adult division, we have what are called vocational services that can run the gamut of just in a center trying to help people understand how to partake in a manufacturing process. But we also have what is called supported work programs, where a DDI direct care professional will go out with that individual to their job, to the job site. I'm happy to say there are over 80 companies on Long Island that we are dealing with who have gone the extra mile and given people with developmental disabilities a chance to have a job.
With the grocery outings, Matthew has choices of what he likes to pick out, for whether it be dinner or snack. It gives him a little bit of independence and dignity to pick out his own food and teaches him money management.
When you're dealing with a person with autism or developmental disability, they might not be able to communicate with you. They might not be able to tell you where it hurts. It's very difficult to get a history and diagnosis. In the mid-90s, we created a medical dental division called Opti Healthcare.
We provide comprehensive medical, dental, and psychiatric and rehabilitative services for individuals who have developmental disabilities and mental health disorders.
We're going to see if we can do an eye test.
What I've learned is that here at TDI is that you can learn sometimes more in 30 seconds or 5 minutes from someone's gestures and their expressions and how they present with something than taking a 30-minute history. And that if your eyes are open and your ears are open, you can learn a lot about people.
You know, we all want our children to be happy. That's the primary thing in any parent. And Matthew's happy. And so whenever I feel badly about things, and I often do, I say, you know, he's happy. What else do I need?
What we do is truly one person at a time, one life at a time, one child, one adult, and trying to meet their needs and trying to see to it that they will have a place for the rest of their life.